Assalamualaikum warahmatullahi ta'ala wabarakatuh. We are the group 1, set B, and our topic is about the immunologic disorder. So, immunologic disorder is disease or conditions caused by dysfunction of the immune system and include allergy, autoimmune disease, autoinflammatory syndromes, and immunological deficiency syndromes. So, for the allergies are the result of your immune system's response to a substance. Immune responses can be mild from coughing and runny nose to a life-threatening reaction from anaphylaxis. A person become allergic with their body develop antigens against a substance. So, for the autoimmune disorder occurs when a person's immune system mistakenly attacks their own body tissue. Autoimmune disorders are broadly grouped into two categories. The first category is the organ-specific, means one organ is affected, while in non-organ specific disorders, multiple organs or body systems may be affected. So, for the autoinflammatory disorder is innate immune system activation disorders. Individuals with autoinflammatory disorders classically have recurrent episodes of inflammations that occur in the absence of high-titer autoantibodies and autoreactive T cells, making them distinct from autoimmune disorders. So, immunological deficiency syndromes are disease or conditions in which there is a loss of or defect in a component of the immune system. So, patients with these syndromes have an increased susceptibility to infections and to developing certain cancers. Example is the Job syndrome or leukocyte adhesion defects. So, for the first topic about immunological disorder is the multiple sclerosis. So, multiple sclerosis is a potentially disabling disease of the brain and spinal cord central nervous. In multiple sclerosis, the immune system attacks the protective sheath, myelin, that covers nerve fibers and causes communication problems between your brain and the rest of the body. So, eventually, the disease can cause permanent damage or deterioration of the nerves. Signs and symptoms of multiple sclerosis vary widely and depend on the amount of nerve damage and which nerves are affected. Some people with severe multiple sclerosis may lose the ability to walk independently or at all, while others may experience long periods of remission without any new symptoms. There's no cure for multiple sclerosis. However, treatments can help speed recovery from attacks, modify and course of the disease, and manage symptoms.
So, for the symptoms of the multiple sclerosis, so signs and symptoms may differ greatly from person to person. So, and over the course of the disease depending on the locations of the affected nerve fiber. So, symptoms often affect movements such as the numbness or weakness in one or more limbs. So, that typically occurs on one side of your body at a time. So, or your legs and trunk. So, next one is the electric shock sensation that occurs with certain neck movement, especially bending the neck forward. Then the next one is the tremor, lack of the coordinations or unsteady gaits. Then for the visions problems are also common, including the partial or the complete loss of visions, usually in the one eye at a time, so often with pain during eye movement. Then the next one is the prolonged double vision. So, and the last one is the blurry vision. Then the next one is the multiple sclerosis symptoms may also include the slurred speech, fatigue, dizziness, tingling or pain in parts of your bodies, and also the problem with sexual bowels and bladder functions. Then the risk factors of the multiple sclerosis is this factor. So these factors may increase your risk of developing multiple sclerosis. So first one is the age. So that is the first risk factors. So multiple sclerosis can occur at any age, but onset usually occurs around 20 to 40 years of age. So however, younger and older people can be affected. And the next one is the sex. So women are more than 2 to 3 times as likely as men are to have relapsing. So remitting the multiple sclerosis. Then the next one is the family history. So if one of your parents or siblings has had multiple sclerosis, you are at higher risk. So if developing of the diseases, then the next one is the certain infections. A variety of viruses have been linked to multiple sclerosis, including the uh, Epstein-Barr, the virus that causes infections, mononucleosis. So the next one is the race. So white people are particularly those of northern European descent. So are at a higher risk of developing multiple sclerosis. So people of Asian, African, or Native American descent have the lower risk. Then the next one is the climate. So multiple sclerosis is far more common in countries with temperate climates, including the Canada, the Northern United States, then the New Zealand, Southeastern Australia, and the Europe. Then the next one is the vitamin D. So having low levels of vitamin D and low exposure to sunlight is associated with the greater risk of multiple sclerosis. Then the next one is the certain autoimmune disease. So you have a slightly higher risk of developing the MS or the multiple sclerosis if you have other autoimmune disorders such as the thyroid disease or the perniosis, anemia, then this cirrhosis, type 1 diabetes, or inflammatory bowel disease. Then the last one is the smoking. So smokers who are experience an initial event of symptoms that may signal multiple sclerosis are more likely than non-smokers to develop a second event that confirms relapsing, remitting the multiple sclerosis. Then these are the complications of the multiple sclerosis. So people with multiple sclerosis may also develop the muscle stiffness or spasms, then paralysis, typically in the legs, then probably with the bowel or sexual functions. So and the next one is the mental changes such as the forgetfulness or mood swings, and also the depressions and epilepsies. So the patients with multiple sclerosis, so these are the nursing management. So for the patient with the multiple sclerosis, a disease of the central nervous system that is disrupt signals within the brain, also the signal between the brain of the body. So we likely experience symptoms that may negatively impact their quality of life. So due to the complexity of the multiple sclerosis and its disease burden, so multiple disciplinary management that combines the pharmacologic and non-pharmacologic strategies with the patient's education is necessary. So diagnosing relapses of the multiple sclerosis is in clinical practice can be difficult due to the multiple subtypes of the multiple sclerosis. So variations of the symptomatologies and the pseudo relapses. So managing the relapses are also represent in own set of the challenges. So for example, evaluating in the treatment is appropriate and determining which agent would be most effective for the patient if treatment is recommended. So that's all for the signs and symptoms and the nursing management of the multiple sclerosis.
Diabetes mellitus. Objective learnings. The learner must be defined the type 1 diabetes mellitus. The learners must be familiarized with signs and symptoms, complications, diagnosis, causes, and treatments. Diabetes mellitus, also called diabetes, is a term for several condition involving how your body turns food into energy. So, what is type 1 diabetes? Type 1 diabetes, sometimes called juvenile diabetes or type 1 diabetes mellitus, is a chronic autoimmune condition where your pancreas produces little or no insulin, that cruel hormone that help convert the glucose in your blood stream into fuel. After digesting a meal, our bodies take the carbohydrates from our food and convert them into glucose, which travel through our bloodstream into our cells. Our cells then use the glucose as fuel to power everything they do. So, the role of glucose. Glucose, as sugar, is a main source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, food and your liver. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. Your liver stores glucose as glycogen. Insulin works like a key for the glucose, unlocking the cells so that the glucose can enter. Without insulin, our cells can function because the glucose remains locked out. As a result, glucose from food accumulates in the bloodstream. Too much accumulated glucose leads to a rise in blood sugar, which then causes symptoms to develop. So, the role of insulin. Once a significant number of islet cells are destroyed, you produce little or no insulin. Insulin is a hormone that comes from a gland situated behind and below the stomach, pancreas. The pancreas secretes insulin into the bloodstream. Insulin circulates, allowing sugar to enter your cells. Insulin lowers the amount of sugar in your bloodstream. As your blood sugar level drops, so does the secretion of insulin from your pancreas. Type 1 diabetes sign and symptoms. Weight loss, frequent urination, irritability, blurry vision, and vertebrae. So the causes. The exact cause of type 1 diabetes is unknown. Usually, the body's own immune system, which normally fights harmful bacteria and viruses, mistakenly destroys the insulin producing islet or islets of lung harms cells in the pancreas. Other possible causes include genetics, exposure to virus, and other environmental factors. Ears causes type 1 diabetes, so GL2 viral infection, and pancreas injury. The research believe that type 1 diabetes can be triggered a virus such as the common flu or cold. Pancreas injury very rarely type 1 diabetes can be triggered by a trauma to the pancreas. So, risk factors of type 1 diabetes. Some known risk factors for type 1 diabetes include family history, genetics, geography, and age. So, pag sinabi natin family history, so kung may family nagkaroon ng diabetes, so sa mga family nagkakaroon din ng risk of developing the condition. So, pag sinabi natin genetics, ito yung kapag may lahi kayong may diabetes, so nagkakaroon din ng type 1 diabetes. So, sa age naman, the first peak occurs in children between 4 and 7 years old, and the second peak children between 10 and 14 years old. So, sa complication naman ng diabetes, over time, type 1 diabetes complication can affect major organs in your body, including the heart, blood vessels, nerves, eyes, and kidneys. Maintaining a normal blood sugar level can dramatically reduce the risk of many complications. So, sa complication of diabetes mellitus, there are two, acute and chronic complication. So, acute complication, under that, ketoacidosis, the hyperglycemic hyperosmolar non-ketotic syndrome, and hyperglycemia. So, under naman sa chronic complication, disorders of the microcirculation, neuropathies, nephropathies, retinopathies, macrovascular complication naman, foot ulcers. So, for diagnosis for diabetes, diagnostic tests include glycated hemoglobin EC, A1C test, random blood sugar test, and fasting blood sugar test. So, pag sinabi natin glycated hemoglobin A1C test, this blood test indicates your average blood sugar level for the past 2 to 3 months. An A1C level of 6.5% or higher on two separate tests indicates diabetes. So, pag sinabi natin random test blood test, a blood sample will be taken at a random time and may be confirmed by a repeat testing, regardless of when you last ate a random blood sugar level of 200 mg per dl, 11.1 mm per year or higher sugar suggests diabetes, especially when coupled with any of the signs and symptoms of diabetes such as frequent urination and extreme thirst. So, fasting blood sugar. A blood sample will be taken after an overnight fast. Blood sugar level less than 100 mg per dl, 5.6 mm o L/L is normal. Blood sugar level from 100 to 120 mg /dl, 5.6 to 6.9 mm o L/L is considered pre-diabetes. So, after the diagnosis, you regularly visit your doctor to discuss diabetes management. During this visit, the doctor will check your A1C levels. Compared with repeated or daily blood sugar tests, A1C testing better indicates how well your diabetes treatment plan is working. Then, the prevention. There's no known way to prevent type 1 diabetes, but the researchers are working on preventing the disease or further destruction of the islet cells in people who are newly diagnosed. Ask your doctor if you might be eligible for one of these clinical trials, but carefully with the risks and benefits of any treatment available in a trial. So for the treatment for type 1 diabetes includes taking insulin, carbohydrate, fat and protein counting, frequent blood sugar monitoring, eating healthy foods, exercising regularly, and maintaining a healthy weight. Insulin can be delivered by a pump, a pen, injection with a syringe. Insulin and others medication. Anyone who has type 1 diabetes needs lifelong insulin therapy. Types of insulin are many and include short-acting regular insulin, rapid-acting insulin, intermediate-acting NPH insulin. 4 ways to manage type 1 diabetes. So first, take insulin is as prescribed. Then number 2, get regular physical exercise. Eat a balanced diet with accurate carbohydrate counts. Then 4, check blood sugar level as directed by a doctor.
So, the ulcerative colitis is an inflammatory bowel disease or IBD that causes inflammation and ulcers, sores in your digestive tract. So, the ulcerative colitis affect the innermost lining of your large intestine, colon, and rectum. Symptoms usually develop over time rather than suddenly. So, the pathophysiology of ulcerative colitis is usually begin in the rectum. It may remain localized to the rectum, ulcerative proctitis, or extend proximally sometimes involve the entire colon. Rarely, it involves most of large bowel at age. So, the inflammation caused by ulcerative colitis affect the mucosa or submucosa, and there's a sharp border between normal and affected tissue. So for the clinical manifestation, ulcerative colitis symptoms can vary depending on the severity of inflammation and where it occurs. Signs and symptoms may include diarrhea, often with blood or pus, abdominal pain and cramping, rectal pain, rectal bleeding, passing small amount of blood with stool, rectal urgency to defecate, inability to defecate despite urgency, weight loss, fatigue, fever in children, failure to go. Most people with ulcerative colitis have mild to moderate symptoms. So the course of ulcerative colitis may vary, with some people having long period of remission. So assessment and diagnostic finding of ulcerative colitis. So a diagnosis of ulcerative colitis can be confirmed by examining the level of extent of bowel inflammation. This is initially done by using sigmoidoscope, a thin, flexible tube containing a camera that's inserted into your rectum. So this is the complication of the ulcerative colitis. So the possible complication is a severe bleeding, a hole in the colon, the severe dehydration, bone loss, inflammation of your skin, joint, and eyes, an increased risk of colon cancer, rapidly swelling colon, toxic megacolon. So for the medical management of chronic ulcerative chronic, so both medication and surgery have been used to treat UC. However, surgery is preserved for those with severe inflammation and life-threatening complication. So there is no medication that can cure UC. Patients with UC will typically experience period of relapse, worsening of inflammation, followed by period of remission lasting for months to years during relapse. Symptoms of abdominal pain, diarrhea, and rectal bleeding can worsen patient reality of life. So the medical management of chronic inflammation. So anti-inflammatory drugs are often the first steps in the treatment of inflammatory bowel disease. So anti-inflammatories include corticosteroids and aminosalicylates such as mesalamine, Asacol HD, Delcizol, and others. Balsamides, Colazole, and also osalazine, Dineptuc. So, nutritional therapy. Oral fluids and a low residue, high protein, high calorie diet with supplemental vitamin therapy and iron replacement are prescribed to meet nutritional need. Reduce inflammations and control pain and diarrhea. Fluid and electrolytes imbalance from dehydrations caused by diarrhea are corrected by IV therapy as necessary if the patient is hospitalized, or by oral fluid. If the patient is managed at home, any food can exacerbate diarrhea are avoided. Milk may contribute to diarrhea in those with lactose intolerance. Cold food and smoking are avoided because both increase intestinal motility. Parenteral nutrition may be indicated. So the pharmacologic therapy. Sedatives and antidiarrheal and antiperistaltic medication are used to minimize peristalsis in order to rest the inflamed bowel. They are continue until the patient's stool approach normal frequently and consistently.
What is glomerulonephritis? Glomerulonephritis is a kind of kidney disease. It involves damage to the glomeruli, tiny filters inside your kidneys. It caused by a variety of things from infection to problems with the immune system. Sometimes glomerulonephritis is a mild and soon goes away. Other times it hangs around and leads to kidney failure and other complications. How can I manage glomerulonephritis? If you have a glomerulonephritis, get your kidneys checked on a regular basis and follow a medical advice and take a prescription if needed to manage the cause. You also may have to limit the amount of salt, protein, and potassium you eat. Doing so can ease the stress on your kidneys. What is the outlook for people with glomerulonephritis? Different people have a different outcome with a glomerulonephritis. Some cases go away without any treatment, and some people find that treatment improves or maintains kidney function. But others may develop a long-term health problem such as blood clots. Blood clots including deep vein and thrombosis, or pulmonary embolism, chronic kidney disease, hypertension, and high blood pressure. high cholesterol, kidney failure quickly or after several years, nephritic syndrome with a red blood cells leaking into a urine and making it look red or brown. Nephritic syndrome and nephrosis with a protein in the urine often leading to a foamy urine and swelling in the body. Can I prevent glomerulonephritis? Yes, and eat a healthy unprocessed food, manage high blood pressure with a low salt diet, exercise and medication, prevent infection by practicing good hygiene and safe sex. Also avoid using needles for illegal drugs and tattoos. Say a healthcare provider whenever you think and you have an infection like a strep throat. The causal factor that underline acute GN and can be broadly divided into infection and non-infection groups. Infection. The most common infection causes of acute GN is infection by Streptococcus species. Example, group A beta hemolytic. Non-infectious cause of acute GN may be divided into primary renal disease, systematic disease, and miscellaneous condition or agents. Clinical manifestation presenting as symptoms appear in 1 to 3 weeks after the onset of a streptococcal infection. Hematuria. Usually, the presenting of symptoms is ghostly, bloody urine in the caregiver describe the urine or smoky or bloody. Periobetal edema. Periobetal edema and or fetal edema may accompany or precede hematuria. Fever. Fever may be a 103 Fahrenheit to 104 Fahrenheit at the onset by decrease in a few days to about 100 Fahrenheit. Hypertension. Hypertension occurs in 60% to 70% of patients during the first 4 or 5 days. Oliguria. Oliguria. Production of a subnormal volume of urine is usually present in the urine and has a high specific gravity and contains albumin and red and white blood cells and cash. Fluid overload. Observe a periobital and or fetal edema and hypertension due to fluid overload in 70% of patient crackles. Example, if pulmonary edema elevated a jugular venous pressure ascites and pleural effusion possible. Cerebral symptoms consisting mainly of headache, drowsiness, convulsion, and vomiting occur in connection with hypertension in a few cases. Assessment diagnostic findings. There are a lot of renal syndrome that may mimic the symptoms of acute GN, so accurate assessment diagnosis is essential. Initial blood test. A CBC is a perform. A decrease in the hematocrit may demonstrate dilatation anemia in the setting of infection. Etiology and fluorosis may be evident and electrolyte levels are measured, particularly in the serum potassium, along with the BOM and creatine to allow estimation of the glomerular filtration rate and GFR. The BOM and creatinine level will exhibit a degree of renal compromise of GFR be decreased. Complement labels. Differentiation of a low and normal serum complement label may allow the physician to narrow the different diagnoses. Urinalysis. The urine is dark if specific gravity is a greater than 1.020 RBC, Cas are present and proteinuria is observed. Streptozine test. The streptozine test, it includes streptococcal antigen that are sensitive for screening but are not quantitative, such as DNA, streptokinase as streptolysine O, and hyaluronidase, the anti-streptolysine. Titer is increased at 60 to 80% of patients, increasing ESO titers. All streptozine titers confirm recent infection. Blood and tissue cultures is indicate patient with fever, immunosuppression, intravenous drug use in history, and dwelling in shot of catheters or culture throat and skin. Lesions rule or streptococcus species may be obtained. Medical management. Treatment of acute glomerulonephritis is mainly supportive because there is no specific therapy for a renal disease. Diet. Sodium and fluid retention should be advised. Treatment of signs and symptoms of fluid retention. Example, edema, pulmonary edema. Protein retention for proteins with azotemia, and should be advised if there is no evidence of malnutrition. Activity. Bed rest is recommended until signs of glomerular inflammation and circulatory congestion subside, as a prolonged inactivity is of no benefit in the patient recovery process. Long-term monitoring studies is children with EGN have revealed a few chronic sequelae. Pharmacologic management. The goals. The goals of pharmacotherapy are to reduce mobility, to prevent complications, and to eradicate the infection. Nursing management. The nurse role in the care of a child with EGN is crucial. Nursing assessment of a child EGN include physical examination, obtain a complete physical assessment, assess weight, monitor daily weight to have a measurable account on the fluid elimination. Monitor intake and output. Monitor fluid intake and output every 4 hours to know and progressing condition by glomerular filtration. Assess a vital signs and monitor BP and PPR every hour to know progression of hypertension and basis for further in nursing intervention or referral. Assess a breath sounds. Assess for adventitious breath sound to know for a possible progress in the lungs. Nursing diagnosis. Based on the assessment data, the major nursing diagnoses are an effective breathing patterns and related to the inflammatory process, altered breathing pattern related to the inflammatory process, altered urinary elimination related to decrease a bladder capacity or irritation to a secondary to infection. Excess fluid volume related to a decrease in regular mechanism, renal failure with the potential of water. Risk for infection related to a decrease in the immunological defense, imbalanced nutrition, less than body requirements related to anorexia, nausea, vomiting, risk for impaired skin, integrity related to edema and pruritus, hyperthermia related to the effectiveness of thermoregulation secondary to infection.